So maybe take us through, I know I've talked to Ginny about this, of course, but take us through like what happened with Ginny. She had like
You
just one.
recall. I should have given her a primer.
Yeah. I'm
Yeah.
like,
Well,
oh,
yeah. But
no, how could I forget?
Well, then there's that, right?
So, I, so at that time, so we had just gotten through, this is what I can't remember, the first dose or the second dose. Is it the first
Only
dose?
had only had one.
Yeah, it was just one, right?
Yeah.
Okay, so we had just gotten through that first dose. It wasn't that far in, maybe like 2 weeks or so in after that first dose.
Yeah, I think you're right.
Yeah.
It wasn't that far in.
Yeah, but it was so, typically we always tell people side effects will happen in the first 3 months, but they can happen as early as a couple of days or a couple of weeks in. And that was Ginny. She was in the hospital
That's
having
the
horrible
only
diarrhea.
normal that I followed, actually.
Yeah. So
That
she
was
just
the only time I was normal in this whole.
But I mean, it was rip-roaring diarrhea. And like we tell people, some of these side effects can come on suddenly. One day you're fine, and the next day it's just the spigot's opened and
So to
something
speak.
very dramatic happens. And that was definitely you.
Yeah.
So we, and she was a very responsible, she always is still a very responsible patient, and, told us right away. We got her in right away. And then we did scans and then realized that her colon was quite dilated to the point where we were worried about potentially getting a tear in the colon. And so we were getting x-rays at the time, like daily x-rays. And then kind of the worst happened,
Yeah.
which is that, and within days, right, the colon, so it's something called a perforation, but you can think of it as like a full balloon that pops, right? And it's full of like air, inflammation, that kind of thing. And it gets stretched too thin, and there's a tear. And once you have a tear, it can be fatal, right? So because the inside of the intestines is technically dirty, right? And you know what
Yeah.
happens when you go to the toilet, but that's the stuff that's not supposed to get inside your body. It's just supposed to sort of go through your digestive tube and come out, right? And so that was something that could have killed her, and we got her off to emergent surgery.
And I almost did, actually.
Yeah,
Almost.
got her off to emergent surgery, like really took out that piece of colon, washed everything out, and that began a very long recovery journey.
Yes, and so it
Yeah.
begins.
yeah,
So
and that was
that's
only
like,
that was
yeah,
only 2 weeks in, right? That was like,
yeah.
yeah.
So this is like one of the classic immunotherapy side effects is diarrhea. Most people just have diarrhea, but for certain people, it can advance very quickly.
Now, I did have a question, and
Yeah.
trauma, I found out changes the central nervous system, right? So it's always like on high alert.
Yeah.
Did that have anything to do with how I reacted to the immunotherapy? The fact that my central nervous system was on high alert for like, so it was worn out, basically?
Yeah, so that's a fantastic question. I think there is some degree that we don't understand that stress and trauma beforehand could relate. I think when we think about it medically, we're thinking about more specific things. So I think for you in particular, that colonoscopy that you had had about a year before,
It
where
was just months before, to be honest.
yeah, it was like
It was
the
in
fall.
March, I
It was the
think.
fall, and we started in the spring.
Yeah.
It was, yeah. So that colonoscopy showed a little bit of what we call microscopic colitis. So
Mhm.
microscopic colitis is something that I think a lot of folks used to blow off as not enough change to really cause a lot of trouble in terms of diarrhea, all of those things. But we're starting to understand that that's a signal that there might be some inflammation there already, and that you add more inflammation with the immunotherapy, and then you're the person who's more likely to have that sort of really severe reaction because there was that little bit of inflammation before. So we know that trauma can result in higher inflammation in
Yeah.
levels in people. So things like heart attacks and clots and strokes can
Mhm.
happen more often in people who have had like sort of a lot of stress and inflammation.
Mhm.
But those ties are not totally direct in sort of our medical science today.
Uh-huh.
Like, is it possible? I think, we may find that out someday. Is like, let's say in 20, 30 years, we have like panel that can like detect, higher levels of inflammation from environmental stresses. And I think we're finding a lot about that in our diversity work.
Yeah.
Um,
Because
Yeah.
I've always had a problem with inflammation. So I wondered if that
Yeah.
played a part in how I reacted to the immunotherapy. But
Yeah.
he said, who knows?
Yeah. No, it's a good question.
Maybe. It's a maybe.
I
Yeah.
think those are great questions
Yeah.
because I mean, it's so hard to know because everybody is so different when you get down to that level, of how people react to things that, um, you know, then how do you move forward in like the next patient or what you're learning from all of this now? Because immunotherapy is on the scale of things fairly new still. So you're just finding
Mhm.
out people are
Yeah.
experiencing now that who have
Yeah.
been on immunotherapy. So
Yeah.
We're moving past immunotherapy in some cases.
Yeah, no, it's true.
yeah,
Now it's cellular therapy is
Yeah.
the new kid on the
right.
block. Yeah.
Yeah, it's all happening really fast. So
Yes. Faster than almost we can like keep up with it, I will say.
Yeah.
yeah,
Which is why I'm glad you guys
what
are
an
doing things like
exciting time.
this. Yeah.
What an
'Cause it-
exciting time to be in, to have your job,
It is, but it's also makes it so much more important to have things like this, right?
yeah,
Because um, it's moving so fast that we can barely keep up. And in some ways, we've found that patients are our best allies in getting the education out there because your average ER doc, your average PCP still doesn't totally understand immunotherapy. But the more patients they have like you who have had immunotherapy and know it's different from chemotherapy, you can sometimes get to those doctors that we don't come across as often
right?
and move that education. But I think it's equally important to have a venue where patients can understand this so that patients are smarter about what's happening, but also, just an education for everyone.
Right. Yeah. I think that's important. Yeah.
it's true. I mean, I know that,
Absolutely.
yeah, I mean, and the doctors learn from the patients too, like
Mhm.
something that a side effect could be happening that they've never
Yeah.
seen before, and it starts a whole discussion about, where's this coming from? So the communication is really important, I think.